Hey guys, let's see a normal scan today. This is the bone window. We can see the vault, the parietal, the frontal, and the occipital bones. And the cerebral hemispheres, the frontal lobes, the parietals, and we go lower down, the occipital lobes and the temporals, and these are the lateral ventricles, third ventricle, the fourth ventricle, and this is cerebellum, cerebellar hemispheres, and you see the brainstem structures like midbrain, pons, and medulla. Now we enter into the base of the skull and into the neck. And the base of the skull, you can see the infratemporal fossa on both sides. If you see anteriorly, these are the maxillary sinuses. The maxillary sinus open into the nasal cavity. There is a nasal septum, and these are the terminates. And when we move further down, this is the alveolus, upper alveolus. And then it continues as hard palate, and then the soft palate. We'll appreciate it in a other view. And this is the tongue. If we go down, the oral cavity and the tongue, and further down we can see the mandible. Then when you see the posterior aspect, here we can see the vessels, neck vessels, the carotids and the jugulars. And the posteriorly, this is the sternocleidomastoid, which is extended from the mastoid to the sternal or near the sternoclavicular junction. And further down, when we go down, we can see the parietal glands bilaterally, and further down, this is the submandibular glands. When we go further down, we enter into the larynx. You can see the larynx. You can see the larynx, and you see the thyroid gland. The thyroid gland is hyperdense because it contains iodine in it. Then we can appreciate the cervical vertebrae and both the clavicles moving forward anteriorly, and through the bilateral capillae and the heads of the humerus. Now we enter into the thorax. In thorax, you can see both the lungs, the lung window. On the right, it is upper, middle, and lower lobes, and left it is upper and lower lobe. This is the fissure on the left side, and on the right side there are two fissures: the major fissure and the minor fissure. The minor fissure. And when you see the mediastinum, you can see the arch of aorta. Actually, the ascending aorta continues as arch, and then as descending aorta. The arch, when you trace the arch, you can see the left ventricle. Okay, this is the left atrium. Before going to that, we'll see this vessel here, this superior vena cava. You see the left brachiocephalic and the right vessels open into the superior vena cava, which opens into the right atrium. This is the right atrium, and the right atrium drains into the right ventricle. You see the right ventricle and trace the right ventricle. The right ventricle, and from the right ventricle, here comes the pulmonary artery, which divides into the right main, this one, and the left main pulmonary trunks. And in the posteriorly, this is the left ventricle. The pulmonary veins empty into the left ventricle, which further drain from the left the pulmonary vein drains into left atrium. From there, the blood is pumped into the left ventricle. From there, the aorta arises. Now, when we move further down, we enter into the abdomen after In the abdomen, we see the large liver, which has left lobe and right lobe, and a caudate lobe here. Then another caudate lobe. Then you see there's a spleen here. And anterior to the spleen, you can see the stomach. In this case, it's not distended. And when we trace the stomach, you can see the body of the stomach, the pylorus in the antrum. Then it moves into, opens into the first part of the duodenum and into the second part. And when we trace the spleen, the splenic hilum, splenic vessels, and the splenic hilum, you see the tail of the pancreas. The pancreas, and it moves anteriorly is the body of the pancreas, and it opens into the second part of the duodenum. And from the other side, even the gallbladder with its ducts opens into the second part of the duodenum. The splenic vein and the superior mesenteric vein both join and form the portal vein. The portal vein opens up into the liver. And posteriorly, you can see both the kidneys, the renal vessels simultaneously, and you can see the inferior vena cava here. When we go further down, you see all the small bowel and the large bowel. We'll trace the large bowel. You see this is the ascending colon on the right side. When you go up, and it ascends, and the hepatic flexure, and it continues as the transverse colon. This one, the transverse colon, we trace it. It continues as splenic flexure and as descending colon. The descending colon, when we trace it down, you see this one here. This is sigmoid, the rectosigmoid, and it opens into the rectum. And you can see the bladder, and below the bladder is the prostate, as a male patient. And the muscles, these are the psoas muscles on both sides. They pass anteriorly and downwards, and you can see the iliacus muscle here, both sides. And there are the gluteal muscles, maximus, medius, and minimus, and other muscle groups. When we move down, these are the pelvic girdle bones, and the femori, both the femora, the heads of the femora, and the femora, they continue down, and the shafts. These are the thigh muscles, the medial compartment, the adductors, the anterior compartment, the quadri, and the posterior compartment. This is sagittal image. You can see the vertebrae. If there are any osteophytes. The osteophytes. You can appreciate the aorta, the thoracic and the abdominal aorta better on this sagittal image. This is the coronal image. Anteriorly, these are the orbits with eyeballs in them, the frontal sinuses, and so the maxillary sinuses, the inferior turbinates, the middle turbinate, the nasal septum. This is the hard palate, which we couldn't appreciate on axial images. This is the sphenoid sinus. You see anteriorly. Below this hard palate is the oral cavity. When we go posteriorly, hard palate continues as soft palate and as uvula. And we see similar structure here. This is epiglottis. It's in the larynx. You see, this is the external artery meatus in the middle ear. You can appreciate them. And in this, the petrous bone is the internal ear. You can appreciate it. Right main bronchus, the left main bronchus. This is the left upper lobe, the right upper lobe. You can better appreciate it. It's telling me this. This is the right lung. You can see this. This is upper lung, upper lobe, right lung. And there is a feature. This is the major feature, and this is the minor feature. This is the middle lobe. This is the lower lobe. This is the upper lobe. When you go on to the left, there is only one feature: the upper lobe and lower lobe. And the left lingula is somewhat similar to right middle lobe. Thank you.